Hello, I'm Dr. Langdon, Medical Director at the Langdon Center in Guilford, Connecticut. Today we're going to see a video of CoolSculpting. And CoolSculpting has become quite popular. It's definitely not a commodity though. It's important that you go to a center that has a lot of experience. The most important thing is placement of the applicators, which are the part of the apparatus that goes right against the skin. So our nurse Hardeen will demonstrate how to place the applicators in order to get maximal improvement. You should also go to a center that has a lot of experience with CoolSculpting. We actually were the first in our area to start doing this procedure. We have a room dedicated to CoolSculpting with a special padded table. We also have all of the applicators, the full array, so we can treat all the different parts of the body that are treatable. Okay, so enjoy the video with Hardeen. Thank you.
Bubbles. This is a protective layer for you between the cooling panels and your skin, and there's also the liner, which is also acts as a protective agent. I need to take off my gloves because this is very slippery for me. I'm just going to put this on, so I'm going to gel pat it, and then I have to increase this to 75. This is the recommended 75 and 60. This is the recommended treatment pattern from CoolSculpting, Celtic, that's the company. So just hold your arms gently out to the side. I want you to lean in just a little bit, like towards me. Yep. I'm lining it up. I made T's at the end, so that's where the corners of my T's are going. I'm just holding it up against your skin. And you feel it go in?
Yep.
Okay. And now I'm looking. I can see the T underneath the cup. I can see that the bulge that I am treating is sucked up and it's above these metal bars.
Okay.
That shows that we're going to get a good treatment. We're getting an effective treatment, so I can see your skin above that.
Okay.
So what I need you to do now is just kind of lay down. I have some pillows. Don't worry. I haven't engaged the cooling yet, but I want to get you situated. This is how I manage to. Pillow. This is how I manage to keep our pop-off rates down and used up cycles. We can't get the cycle back once it's spent. So I'm gonna just make sure that you're comfortable. I have a bobby here. Here, want to put this between your legs? I can put your head up if you'd like.
This is actually fine.
This is actually okay. All right, so. You are good. You can lean forward if you want. You can lean back. This isn't going to go anywhere. It doesn't have any unnecessary torque. And, a different pull. I'm going to engage it.
Okay.
All right. So after this, we have to make sure that you stay on for 60 minutes, and it's not going to let you go anywhere. There you go. It started. So now it counts down if you want to see it. Right there. This is your call bell.
Okay.
The call bell goes to me, to my beeper. If anything goes wrong, you just push this and I'll come running.
Okay.
If you don't use it, that's fine. Can you reach it?
Yes.
I have to make sure.
Yep.
I will come running. It will notify me when there's 3 minutes left, there's 2 minutes, or 10 minutes left, 3 minutes left, 2 minutes left, and then I'll come in and massage. So you may not hear anything, you might just hear this vacuum going. And that's all it is. That's as loud as it is, that's as hard as it is. You're gonna feel pulling, stretching, maybe some tightness. It's gonna relax afterwards because you're gonna relax. It's gonna be cold.
Okay.
It gets down to about 50 degrees Fahrenheit. It has to stay on for 50 minutes, and then it starts to loosen the vacuum. You'll feel it. You may feel it. Not everybody can feel it, but it has its own massage within the last, I think it's like last 8 to 10 minutes. You feel it go, and you're saying, oh, it's falling off, and it's really kind of loosening a little bit.
Okay.
But the cooling has to stay on for that 50 minutes of the 60-minute cycle. After that, I take it off. You're going to have kind of a pink lump, kind of a speed bump type roll. I'm going to massage it. I'll let you feel it to see what it feels like. It's like a pitting edema. You being a nurse, you would know. So it can stay that way, but I just massage it so that it feels like the rest, like how it started.
Yeah.
Feels like the rest of your skin.
Okay.
Nice and pliable, and you know, it's fine. You'll have maybe some pink for the next 20 to 25 minutes, and then we're good.
All right.
And then that's good, and then you just wait for the results to occur.
Sounds good.
All right. And I'll talk more to you if you need to, if you have any other questions. Otherwise, enjoy your treatment.
All right.
All right.
Thank you.
Treatment is over. The cooling has stopped, but the vacuum is still engaged. So I'm going to turn off the vacuum and pull off the applicator. All right. I'm going to stick my fingers in there. Hear that? All right. So this is what we are left with. We have sort of a lumpy, bumpy, little bit of purpley red. You want to feel it? You want to see what it feels like? Give it a press. Just give it a, yeah. So I got right on there. The X's are smack in the middle.
Okay.
That's hard to see a lot of the time when you're looking through that opaque blue cup. And I'm going to massage this for 2 minutes. I have had people tell me that the flanks are nothing, doesn't feel that bad as much as you would in the abdomen. You know, some people experience really a weird feeling, like, oh, I'm feeling warm. Well, it's already warm in here,
Right.
but still, you know, sometimes you can feel a little bit overcome. But the flanks are pretty good. I'm trying to get it to feel the same as the rest of your body.
Yeah.
I don't want to feel any crystallization or any little knots or like kind of pits. I try to get it all nice and smooth. So I'm kind of digging kind of deep. Do you feel
I don't really
cold?
feel much of anything at all.
Does it feel? It feels numb, right? Okay, so this numbness feeling is gonna last.
Okay.
It can last for a few weeks, and then your feeling starts to come back. Some people experience itching. Some people experience mild pain or discomfort, however you want to describe it. With the flanks, it's not as bad as the abdomen, like I said. And I found that with people who have gotten this done before on their flanks. They're like, oh, it's nothing. But if you do experience itching, sometimes it has to do with dry skin. Sometimes your skin will feel more sensitive when you have a piece of clothing on, maybe a tighter shirt, maybe it rubs a little bit. I suggest there's a lotion, it's called Sarna lotion. You can get it over the counter. It's a white bottle with I think it's blue and purple label. That works pretty well. That helps with the pruritus, the itching. Also, just if you don't have that, some people have taken Benadryl. It might be a little bit of an overkill, but when I did my abdomen and my skin felt, it kind of woke me up. The itching, I was like, oh my gosh, I'm itching. So I went and put regular lotion on, and I was good. I went right back to sleep. You get some kind of maybe tingling when your nerves start to regenerate. So here we have your skin. It looks good. It's nice. It's pink. It's going to last. It's going to remain this color for the next 20 to 25 minutes. I don't see any black and blues, although those can develop, which is completely normal. No petechiae, which is the little red dots, the capillaries at the surface of the skin. It works. It did a good job. You had a really good treatment. The red part is the part that's been treated. That's the part that was up in between those freezing panels. And we just wait for the results.
Good.
All right? So we'll get you on the other side.
All right.
All right? Okay.